So I think TV is shifting from building awareness to engagement because it's digitized. So traditionally TV was not able to be measured in a manner that allowed for real action. It was a reach and frequency based capability. Now in the world of CTV and digitization of television, you really do have an ability now to track through the attribution window and optimize within that, which is really, really important and puts TV in a very different perspective than it was before. Now it is very much an attribution channel, less a traditional direct response and more a real direct action channel.
How is TV shifting from building awareness to driving real healthcare engagement?
I think the real difference of how TV is shifting from just TV to a full experience, mobile included, is understanding who is in the actual household. So at LG, we know who's in the LG household. We know which devices are there, we know what you're exposed to on TV, and we know how to extend that reach into mobile. We know how to provide potentially sequential messaging. Ultimately, we understand how to communicate effectively with a consumer in both the TV environment and in the mobile environment or desktop, etc., because we know ultimately who's in the household.
How does CTV data help turn awareness into measurable patient outcomes?
So CTV helps turn awareness to measurable outcomes because today we're not stuck with just a static message and then following up after a campaign. Because of where the digitization of television has happened, we now understand how to optimize in flight, right? And so ultimately we understand what's working and what's not during the course of a campaign and make adjustments and make different adjustments based on the behaviors that we're seeing. So we understand ultimately how people are engaging, we understand who we've reached, and we understand how to potentially either not only just reach them again, but ultimately we can kind of optimize to get to that perfect attribution metric that a client is looking for.
Healthcare marketing is really very specific in terms of what it can and can't do. So how do you balance compliance with creating a seamless patient experience?
So at LG, we know what we do well. We have television data. We know what's happening on the TV. We leave patient data to the experts, whether that's Swoop, as a perfect example of a company who really knows what happens with patients. We let Swoop handle those kinds of things, whereas we bring our expertise for what people are watching and how they're engaging in the television environment. And that beautiful combination of working with the right partner who brings the right audience, and then matching that against the habits that we understand of what you're watching, when you're watching it, and blending that two together gives a really good experience for a consumer and creates a privacy-safe environment so that we can exercise and work cohesively for our brands to ensure that we're delivering a seamless experience while keeping our position and our expertise in our lane and giving companies like Swoop and others the position in their lane.
And how do you see TV's role evolving in the healthcare space? What's coming?
So I think that over the course of time, TV will become more and more an engagement environment, and the behaviors are being set today. So we have a scenario where now you kind of have a lean back TV experience, but a little bit at a time, you're more leaning in, and your TV will extensively become your phone on a screen. And because of that future-facing scenario, you will have an opportunity to engage directly with the TV and have it be much more attributable for conversions and things of that nature. Now, this is a behavior that has to happen over time. It's certainly not intuitive to how people consume television today, but you see that changing now, right? People are using QR codes, and those are the kind of the beginning stages of the engagement. Over the course of time, AI will allow for you to engage directly with your TV using your voice. There will be other capabilities and feature sets that allow for advertising to be much more interactive, and because of that interactivity, you will be able to engage with your television much like you do other devices, and with that comes the attribution, comes the engagement, comes with the opportunity to really understand the consumer behavior and ultimately deliver them relevant messaging that is important for them, meets their healthcare needs, but maintains a privacy-safe environment for them to work in.
So what are some of the best practices for connecting TV with digital and mobile channels?
So one of the best practices is understanding what your partner is capable of doing. At LG, we see this as a great opportunity to connect what people are doing on the TV to what they're doing in their mobile devices or on their tablets, because we understand what's happening in the home, right? We know what's happening with the LG consumer in their home, and what they're engaged in on the television allows us to have a different conversation to what might happen in the mobile environment or in tablet or desktop, etc. Our goal ultimately is to communicate with the consumer in a manner that allows them to have a great advertising experience and for us to understand how to properly reach, conversate, and deliver results.